it's an honor for me to be with Dr. Hwang, who is an expert on everything. So that's why we ask him to do everything, every possible station, and he is so kind to do track motion, endoscopic submucosal dissection, and demonstrate the equipment that addresses a critical need in ESD. Isn't that the case?
I think one of the reasons that ESD is so challenging is because of our inability to provide retraction of the tissue, and so this is a nice tool that goes on a double channel scope. So you do need a double channel therapeutic scope, but it's a retraction device, and basically what you see is, it's one handle. It fits nicely. It's very stable. It's position operator dependent or maneuverable. And what it does is it basically graspers on the end of this arm, and then what you can do is you can open it, so it opens and closes, and then it can rotate. So I can rotate, and then once you close the tissue, closing some more changes your elevation, and so you can then rotate the tissue out. Okay, so it has all these kind of degrees of movement, and so what we're going to demonstrate here is an ESD. So I've already made the incision because you need to start with a flap with this. One thing that you'll notice is we don't have a cap on it, which is good and bad, right? It's great because it gives you a much nicer field of view. And you don't need the cap because this is providing the retraction. So usually we use a cap, because that's part of our retraction technique. We get up there and use the cap to move stuff around. But now that we have this device, you don't really need the cap. And so what I'm going to do is, but you do need to start and create a little flap. So we've made a little flap. And so now I'm going to grab the tissue.
And that's a beautiful view. It's a beautiful, this is a Fuji equipment that gives us a really nice view with a cap and visualization.
And so I grabbed it, and so now I'm going to give it some lift by torquing it, and then I can give it more elevation by closing the handle even more, and then torquing it some more. But here we got nice elevation, and so now I'm going to needle out, please. So here it's a little bit different than ESD because you have to be comfortable in working at a distance. Okay, because usually ESD we're like kind of right up against the tissue, very close. So here it's more like kind of like surgery, where laparoscopic surgery, where we're working at a little bit more of a distance. But I like this because you have a better field of view, right? And so we then kind of maneuver this, and then so now I'm just going to continue to cut. So now I can see the plane really well, right? And so one thing is, though, you got to remember where this device is. So that you don't overcut.
But also advantage is, isn't it, if you unhappy where you grab it, you're not married to whatever, because a lot of retraction devices, if you have it in one way, that's it. There is no way out of it. But here, well, you grabbed it perfectly, but if you didn't.
And then I can push out, so it has a push-pull, kind of. I can push it out, I can lift it up some more, I can rotate it around. So there's a lot of options for me. I can bring it towards me. It does get in the way sometimes, but for the most part, I can kind of.
But you just went through an area in a matter of 3 seconds. Which you probably would have done without, but for a novice like me, it is a plus.
It's nice to have this traction. So let's say I don't like where I'm grasping right now, so I can just undo that, and then I can come out here to maybe somewhere that's a little bit more lateral, and then we can again grab, and then I can torque, and then do some more cutting here.
And I see that you're not trying to retract it too much, because too much tension is also not necessarily a good thing.
You don't want to tear the specimen, so it's like the right amount, and then as it gets bigger, so that's to simulate the muscle layer. So we're kind of deep submucosa, but we're just kind of pulling it off. We're having some generator issues, but it's all right. So. And what we can do with this knife is go ahead and needle back for a second. Let's inject. Give me an injection. Inject. Stop for a second. Let's inject over here.
And that is a knife allows you capability to inject as well.
This is the Fuji flush knife. Okay,
Yeah.
stop. Now needle out. And again, so let's say I want a little bit more retraction, I can retract this way.
And the device, you manipulating all the aspects of the device as an endoscopist. You don't need an assistant to tell anybody to turn, to do anything. You're the one who does whatever
Correct.
needs to be done.
The only thing that the assistant's doing is it's needle out, needle in, and injection.
That's beautiful.
And again, depending on the knife that you use, I mean, you can even control your own injection. So,
Right.
But this is a nice way to provide retraction. Again, retraction is the most important part of ESD, and as we develop better tools for retraction, you know, it'll be easier to do ESD procedures. And so,
well,
this
we're
is
looking
kind of
forward to it.
good example of this. And again, you can kind of torque and change it, move it closer, move it away. So it really does allow you to visualize the plane much better. But the thing that you notice is that I got to resect it a little bit larger. So it's a little bit different technique than standard ESD, right? Because I'm moving my knife a lot more, I'm moving my scope less. And so it's a different technique. I can pull it towards me and get underneath here, you know, so kind of almost like a tunnel type thing. So it really is nice to have
that level of retraction right now.
So, right, it's dynamic retraction, whereas most of the retraction devices that we have right now are kind of static. So once you place them,
you placed it wrong, like me, then you're screwed for the rest of it. Well, it's a beautiful demonstration. Thank you so much.